The Gauteng Department of Health has expressed concern about what it says is a notable increase in the number of coronavirus cases, especially in the Sedibeng District. In a statement, the department says that an increased number of cases has also been recorded in Emfuleni, as well as parts of Tshwane and Johannesburg. This follows recent reports that the National Institute for Communicable Diseases has also warned of a possible resurgence in provinces like the Free State, the Northern Cape and the Northwest. Meanwhile, Health Minister Dr. Zweli Mkhize has, in a statement, noted concerns about the possible import into South Africa of the variant of the coronavirus found in India. Mkhize says that there are currently no direct flights from India to South Africa and that authorities are maintaining strict measures to try and ensure that new variants of the coronavirus do not enter the country, which has recorded 897 new COVID-19 cases and 35 new deaths in the last 24 hours. Acting Executive Director of the National Institute for Communicable Diseases, Professor Adrian Purin, joins us now to speak a little bit more. Prof, thanks for your time. Good to have you with us.
Leanne, and thank you, and morning to your viewers.
So I think I gave a bit of quite a summary as to where we stand right now with regard to COVID, but perhaps you'd like to add a little bit more. What is the general outlook on COVID-19 and the trends in South Africa?
Yes, so I think you're quite right that there are three provinces at least that we are concerned about and have been concerned about for a bit longer, and that is the Free State, Northern Cape and the Northwest Province. And what we've noted there is certainly an increase in cases, and really our concern is where are those cases from? I think there's some evidence that perhaps schools, perhaps certain events may have contributed to those particular cases. So the provinces such as the Northern Cape have not really come out, if you like, of their second wave, and similarly to the Free State. So they've continued to have higher rates of transmission in terms of the positivity rate. And so it's really critical that in those particular provinces that the tracing, the isolation, the quarantine processes be activated to ensure to try and minimize rates of transmission. But you're quite right, all provinces need to be alert, such as Gauteng, in terms of the increases in cases for us to try and control this pandemic as best as possible.
Yeah, I know that the alarm bells were raised a little bit yesterday by the NICD. I think it was the NICD just saying that there has been a notable increase in the number of cases, and Gauteng seems to be seeing a lot. Also talk of perhaps the start of a third wave with regard to seeing these increases in the areas in the province. This is Gauteng I'm talking to. Do you want to elaborate a bit on that for us?
Yeah, so when we came out of the second wave overall, the numbers were actually much lower. So we're talking about really low numbers of cases, not excessive cases as we've seen, if you like, as part of a resurgence. So there are certain metrics which allow us to say, as you say, are we entering into a third wave? And at this particular point, we are on alert, but not necessarily in a third wave. And I think that will really be a decision by the Department of Health to declare that, if that were the case. So I think we just need to be aware of these particular cases and try to manage it as best as possible. To put in place our risk communication, again, it's the emphasis around the wearing of masks and wearing masks correctly, the avoidance of closed spaces, ventilation. These are all critical things that need to be put in place in order for us to really try and manage that. The report that came out, it's led by the NICD. It's a modelling consortium that is looking at various parameters to really give us a scenario of what are the possibilities that could occur. The model does not predict when this wave will occur, but gives us some sense of what it could look like in terms of the current levels of immunity that we're seeing in South Africa in different parts of the country, as well as the likelihood of variants that certainly could contribute to that. So the scenarios, and Gauteng is, if you like, the outlier, is that if we look at a scenario where we don't have control around the non-pharmaceutical interventions that I've just mentioned, we could experienced a far greater resurgence than the second wave. Whereas other provinces, it could approach what was seen in the second wave, but not necessarily so. And in fact, could, if we do implement these non-pharmaceutical interventions, we don't have complications around variants that are highly transmissible, then in fact we could have a resurgence that is far less than what we saw in the second resurgence.
Yeah, I mean, Gauteng has been predicted that from these predictions and graphs that you were coming through and studies basically showing that this is the province that will be hardest hit if there is a third wave, which, as you say, the early little signs are coming in there. But, you know, when we say the hardest hit, what are we expecting? I mean, if we have to look at the second wave that hit South Africa, which hit hard, could we see the same, or could it be a little bit less harsh, or could it be worse?
It could, because again, these are models, so they're not going to be tell you exactly when things are going to happen, exactly the numbers. They give us a range, and within that range, I think what is really critical, at least from my perspective for the public, is really how we manage that. In other words, if we ensure that the non-pharmaceutical interventions, such as the wearing of masks, the avoidance of closed spaces, keeping physical distances, ventilation, applying all those particular interventions that are really critical for maintaining the low numbers that we are currently seeing, then in fact we could manage that particular event. It's also really critical that, again, we are prepared. Our hospitals are prepared. So, for example, are there sufficient beds? Is there sufficient oxygen? Also, very importantly, are people being vaccinated? So these are all contributory factors that can allow us to control. As you can see, they've given us a blue scale, if you like, from a weak or a fast response, for example. And those factors that I've just mentioned can really contribute to what we will see in the current resurgence.
There's a great concern about the strain or the variant that has been discovered in India and the extent that it has been spreading. I think it's the B.1.617 COVID strain. Now, a lot of people are a little bit concerned that there's not enough action that's being taken. I know that this is certainly not something that you have any authority or control over, but a lot of people are asking for restrictions of people that may be traveling from India to South Africa to try and ensure that this strain does not come into the country, because that could have devastating and dire consequences for us. This particular strain, although it's been said that it has not been discovered, even though there was, I think, somebody that's being treated in a KwaZulu-Natal hospital from India, or that was in India, and we're not sure what variant it is. But there are big concerns about that. How would you like to see this particular strain contained and ensure that it doesn't come to South Africa?
It's an important point that is being raised, but remember, variants are in circulation, and some variants are declared as variants of concern. And this variant, you're quite right, the one that you've just mentioned from India specifically, is thought to resemble some aspects of variants that are highly transmissible, as well as avoiding immune evasion. So that is of concern. But remember, we've just come out of a second wave with a variant that exactly had those particular types of principles. So again, our approach should be the same. We should try and monitor. So in this particular case, I'm sure that the sequencing will be done and the data released for us to know. But what will then really be critical at this particular time is that that person is in isolation or quarantined, in isolation, but it's really important that the contacts of that particular individual are investigated in terms of levels of contact and exposure in order for us to test and to isolate, to really try and limit transmission. So again, you've got very good examples of that in the UK. If you remember, there was great concern about traveling from South Africa to the UK, and so they did have restrictions, but yet that virus is in circulation in the UK. In fact, it's in circulation in several other countries. So you can't really always control the importation of variants. It's going to be really difficult. But what you can do, if they are identified, is having a system of monitoring to ensure that you can have a tracing of what the variants are and actually be able to try and limit transmission by actually having a good trace and isolation and quarantine process in place.
When you answered a little bit earlier, you were saying that some of the reasons behind the pockets of spreading that we've been seeing is in fact due to a couple of concerns, and one of them is schools. That could be seen as one of the places where spreading happens. Now, there's a big meeting that's taking place this week, if I'm not mistaken, between the Department of Education and a lot of the different councillors, the basic education, where they're going to decide whether or not schools open completely, because there's still different schools that have got different timetables. Some go, some stay home, and also schools are opening up to different kinds of sports, contact sports. All of these kind of things are being discussed, and it very well may be back to normal for schools. Is it too soon? I mean, from what I'm witnessing, it looks like a lot of people are tired of social distancing and wearing masks and staying away from places. Places are full, people are letting their guard down a lot. And now if we look at schools as well, could these not be very big super spreader hotspot environments?
Yes, I think at schools, I think we need to possibly be more subtle or nuanced. I think that if you look at the various studies in schools, it's not really the younger age groups. It's more possibly in terms of being infected and transmitting the virus. It's not really the younger age groups. It may be possibly in the older age groups, but again, I think we need to investigate and determine if they are, because that would be really different to what the science is saying in South Africa around whether or not schools are really a great source of that. So I think it's really important that be investigated and understood. It's more possibly, I would have thought, universities perhaps, but coming to your point around congregant events where, for example, people are not adhering to the fact that there should be smaller numbers of individuals in a particular area, ventilation, for example, physical distancing, the wearing of masks. So again, it's really understanding what is happening under those circumstances to allow for transmission to occur. We're certainly having low rates of transmission, so this is a good opportunity for us to really, as I said, come back. I know I'm adumbrating the same point, but this is really coming back to the fact we have these low numbers now. It's really critical for us to try and manage those numbers by having a good tracing and isolation and quarantine process. The need for testing is really then therefore important, because if you look at the positivity rates in the three provinces that I've mentioned, they're already higher than the so-called safety net of about 5 to 10%. So again, those particular provinces should really be enhancing their testing in order for us to really get a better sense of what's happening in those particular provinces to really try and manage that. So again, there are further additional tools that can assist us with that in terms of testing, such as the use of antigen testing. So you can really expand your testing to really get a good sense of what's happening and make the necessary interventions as appropriate.
Prof, I know I've got to let you go, but I just want to talk very quickly to the numbers. You also raise a question on the numbers, and they still are relatively low. And I think to the surprise of a lot of people, because we were expecting numbers to be a lot higher, also with reference to the behavior of South Africans, because I think I speak for a lot of people. We don't see those good behavioral techniques we used to have closer to when the virus started. I mean, I think people have let go quite a lot. Is there a reason why the numbers, I mean, look, this weekend was quite bad, 4,500 over the weekend that we did see, and yesterday I think just under 900 cases were confirmed. But these numbers are nowhere near where we were. Is there some form of immunity from the second wave? Is there anything we can attribute this to?
Yes, I think that's what intrigues us. I think in all these particular waves is possibly that we're reaching sort of, if you like, peak levels of transmission, but it's possible that immunity has certainly contributed to that, as well as the fact perhaps that dispersion of people, that the less contact in terms of travel and mobility may change over time, and that leads to a lower level of transmission. So I think those particular factors may well contribute. Because remember, we did go through a very large and substantial second wave as a result of greater mobility, greater contact, and congregant events. So that certainly contributed to that. But once we went to a lockdown level 3 and dispersion, I think that managed to reduce the levels of transmission. So again, I think it's really those particular factors. So you're quite right. I think so-called herd immunity or community immunity may well be a factor that certainly contributes to that.
Yeah.
And we're hoping, of course, with the vaccine coming into play, that in fact even better in terms of managing this particular outbreak.
Are you concerned with a slow rollout, as I let you go, with the vaccines here in South Africa? I mean, if we look at other countries on the continent, they're doing far better. Countries around the world, I mean, we've seen India that are now going through this particular bad dip, but they are vaccinating, and yet we are not even anywhere. I mean, we're just over 300,000 or 317,000, and that's still part of a trial. Are you concerned with the slow pace?
Well, I think that the Department of Health is committed to that. So I'm hoping really that we will see a marked expansion over the next few weeks in order for us to meet those targets, in fact, and that will really contribute to us to managing any further resurgences. So I'm really hoping that the coverage and the rate at which we're getting to the vaccines into the broader community will happen very soon.
Prof, thanks for your time. A pleasure speaking to you. Acting Executive Director of the National Institute for Communicable Diseases, Professor Adrian Purin, talking to us about COVID latest trends and also just reminding us to just use all of the methods that are available to us, especially wearing a mask, to ensure that this third wave is not anywhere near as dramatic as we saw in the second wave here in South Africa. But there are signs that the third wave is beginning, as we heard from the professor, albeit it's a silent alarm, but it is there. So please be careful. All right, let's quickly take a break. We'll be back with you after this.